Good evening, everyone. Myself, Dr. Apoorva Mittal, and I'm your educator for anesthesia on this prestigious platform of Unacademy. And today we'll be discussing about a very important topic, that is transport of oxygen. But before going towards today's topic, let me introduce to the Unacademy. Unacademy is India's leading learning platform for all the online courses, and this is the platform for Neet PG exam. So let's crack Neet PG with Unacademy. And about myself, so I already mentioned myself, Dr. Apoorva Mittal, and I'm your educator for anesthesia. And I did my MBBS from Kasturba Medical College, Mangalore, from Manipal University, and MD Anesthesia in 2019 from Savai Mansingh Hospital from Jaipur. And currently I am pursuing IDCCM from Kobe Medical College Center and Hospital in Coimbatore. So that is about myself. And for getting the Unacademy Learning app, what we have to do is you have to install the Unacademy Learning app. After installing it, you'll be able to avail the live classes and also get the lectures from the top educators who are associated with Unacademy, like Dr. Pavan for surgery, Dr. Zainab for radiology, Dr. Rajesh for general medicine, and Dr. Preeti for pathology. So by getting the Unacademy subscription, you'll be able to avail the classes from all the top educators in India. And also we have two courses, that is the plus course and the iconic course. And in the plus course, what are the advantages of the plus course is you'll be able to avail the live classes, and in those live classes you will be able to interact with the educator. You can ask your doubts pertaining to that topic as at that time itself. And we have daily live quizzes and tests so that you can know about the progress of your preparation. And there are particular batch courses. Okay, there are particular batch courses in the plus classes which will focus about, like, we will focus about the NEET exams, or if you are focusing about the AIMS or the PG exam, which is now an integrated exam. And we have a structured schedule. The advantage of the structured schedule is you won't be missing upon any topic in any subject. So it is better to go about the structured schedule. So what is the difference from the YouTube classes is YouTube classes, you can miss about some topics, because you don't know what will be the course and what will be the topics which will be covered. So by getting the plus subscription from the Unacademy, there will be a structured schedule which will focus and help you to crack the exams, and so all the important topics will be covered in this. So please, therefore, that are the advantages of the plus subscription. Also, we have an iconic subscription. Dr. Porras, welcome to the class. I hope I'm audible and visible. Others also, welcome to the class. If I'm not audible, or if there is some problem with the net, please let me know. Okay, so this is the plus and the iconic subscription. Iconic subscription, you have access to the Unacademy and also the prep ladder. So the Unacademy, I already told you about the advantages. In the prep ladder, you have the video lectures, the question banks, and also the rapid revision courses and handwritten courses. These are the two courses which are on Unacademy, that is the plus and the iconic. Okay, then the Neet PG subscription. Okay, you can have either for the 12 months, 18 months, 24 months, or 36 months. And for that, if you apply my code, that is Apoorva, Apoorva Apoorva, you can get 10% discount on the same. So if you get the 12 months course, that is for 55,000. If you apply my code, that is Apoorva, there will be a discount of around 4,125 rupees. So this is the so please apply my code Apoorva to get the subscription, the plus and the iconic subscription. You can also avail the subscription only for a month or a 3 month. If you want to just revise rapidly through all the topics, so you can opt for a 1 month subscription also, or the 3 month subscription. And if you, here also if you apply my code, that is Apoorva, you will get 10% discount. So these are the advantages. Okay, so that was about the Unacademy Plus subscription and the Iconic subscription. So let's start our today's topic, that is oxygen transport. Guys, am I clear and audible? Please give me a thumbs up if I am clear and audible, so that I can start with today's topic, that is oxygen transport. See guys, what will be my approach for the 4 classes will be, today I'll be just focusing about the oxygen transport, which is a very important topic. Many questions are asked directly from this topic. And also tomorrow I'll be covering about the, carbon dioxide transport. Okay, transport of carbon dioxide. And then, because these are two basics, then I'll be discussing about the two very important topics in anesthesia, that is the pulse oximetry and capnography. So today I'll be discussing about oxygen transport. Now, what is Dalton's law of partial pressure? Okay, here also a direct question is asked, like they can give you this sentence and ask you what this is pertaining to which law. So what does the Dalton's law of partial pressure say? That is, the total pressure which is exerted by the gaseous mixture is equal to the sum of partial pressure of individual component in a gas mixture. तो जितना the total pressure, ठीक है, एक gaseous mixture पे जो exert हो रहा है, that is equal to the partial pressure of individual component. For example, जैसे जो atmosphere है, air है, उसके अंदर the air है, ठीक है. I'm so sorry, just a second. Okay, so the air ka partial pressure 760, the total pressure is 760 millimeters of mercury, and this is equal to the partial pressure which is exerted by the oxygen, nitrogen and the carbon dioxide. So the partial pressure exerted by the oxygen, nitrogen and carbon dioxide, the addition of it gives us a total pressure, and this is the Dalton's law of partial pressure. Okay, now we all know that जब हम लोग एयर को इंस्पायर करते हैं, ठीक है, when we inspire air, तो ऑक्सीजन, okay, I am just talking about oxygen over here. ऑक्सीजन का जो प्रेशर होता है, that is 158 millimeters of mercury in the inspired air. Why? Because the total pressure, the total atmospheric pressure is 170 millimeters of mercury. और कितना ऑक्सीजन है, कितना percentage of oxygen है air में, that is 21%. So 21% of 760 is equal to 158 millimeters of mercury. That much partial pressure of oxygen we are inspiring. But we see कि जो capillaries में oxygen पहुंच रहा है, ठीक है, जो टिश्यू लेवल पे ऑक्सीजन पहुंच रहा है, that is only 40 millimeters of mercury. Now, why there is a fall in the partial pressure of oxygen from the inspired air till the tissue level? ठीक है, इंस्पायर का हम लोगों ने कितना किया, 158 millimeters of mercury, मगर हम लोग देखते हैं कि टिश्यू लेवल पर, ठीक है guys, please remember these are also the important questions. Inspired air में it is 21% of 760, so therefore 158, but at the tissue level we all know that the oxygen is only 40 millimeters of mercury. Now why is it so? Why there is a drop in the partial pressure of oxygen? So that is known as the oxygen cascade. This is also very important point. This is known as oxygen cascade. So what is oxygen cascade? Basically, that is the process of decreasing oxygen tension. Okay, it is the process of decreasing oxygen tension from the atmosphere till the mitochondria. So from 158, ठीक है, टिश्यू कैपिलरीज पे इट इज 40, माइटोकॉन्ड्रिया में बेसिकली इट इज 5 millimeters of mercury. So process of decreasing, please remember what is oxygen cascade. It is a process of decreasing the oxygen tension from the atmosphere to the mitochondria is known as the oxygen cascade. Now why is it so? ठीक है, तो ऑक्सीजन कहाँ से जाते हैं? सबसे पहले एटमॉस्फेरिक एयर में. ठीक है, एटमॉस्फेरिक एयर में ऑक्सीजन कितना है? 21% ऑफ द टोटल प्रेशर, दैट इज अराउंड 158 millimeters of mercury. Guys, are you getting my point? Are you understanding? Dr. Porus, are you understanding? Others, are you understanding? Okay, so from the atmosphere में it is 158. Now we will see alveoli में it is around 149. Then arterial blood में it will further decrease, it will be around 95. Tissue capillaries में only 40, and mitochondria में it is around 5 millimeters of mercury. So it is actually decreasing. Okay, the tension of oxygen is decreasing, and that is known as oxygen cascade. Now why is it happening? Okay, why is it happening? This is the figure which is showing the oxygen cascade and the difference in the oxygen tension at different level. So why does it happen? देखो, जब अपन atmospheric air inhale करे, it goes into the respiratory tract. ठीक है, so atmospheric air we are inhaling, ठीक है, it will go into the respiratory tract. Okay, respiratory tract में क्या होता है? There is a water pressure, water vapor. ठीक है, so water vapor, it exerts a pressure at the body temperature of around 47 millimeters of mercury. ठीक है, तो जब एटमॉस्फेयर से it is going into the respiratory tract, there is a pressure which is exerted by the water pressure, and that is around 47 millimeters of mercury. So the pressure, the total pressure which is exerted by this gas in the moist air, is actually 760 minus 47 millimeters of mercury, and that is 730 millimeters of mercury. ठीक है, और इसमें कितना परसेंटेज ऑफ ऑक्सीजन है? दैट इज 21% ऑफ ऑक्सीजन. ठीक है, सो अकॉर्डिंग टू द डाल्टन्स लॉ, ठीक है, the total pressure is equal to the sum of the partial pressure which is exerted by this. So oxygen ने कितना किया? It is 21% of 713, so it is 149 millimeters of mercury. So actually the partial pressure of oxygen in the saturated moist air is only 149 millimeters of mercury. ठीक है, तो ड्राई एटमॉस्फेयर में it was 160 when it is coming into the trachea. ठीक है, because of the pressure exerted by the water vapor, it is coming down to 150 millimeters of mercury. Are you getting my point? Then this particular point, that is at the tracheal level, okay, at the tracheal level, it is the starting point of the oxygen cascade. Are you getting my point? Are you getting my point? तो basically oxygen cascade में मैं ये बताना चाह रही हूँ कि कैसे from the atmosphere में जो ऑक्सीजन का जो वो था प्रेशर था, दैट वाज 160 millimeters of mercury. ठीक है, उससे जब वो ट्रेकिया में आता है, बिकॉज ऑफ द वाटर वेपर प्रेशर, इट इज कमिंग डाउन टू अराउंड 149 millimeters of mercury. That is because the pressure which is exerted by the gas in saturated is around 713 millimeters of mercury. Now अब कहाँ से आया? एटमॉस्फेयर से ट्रेकिया पे. ट्रेकिया पे से कहाँ जा रहा है? इट इज गोइंग इनटू द alveoli. It is going into the alveoli. So what is alveolar gas equation? what is the partial pressure? Okay, what is the partial pressure of oxygen at the alveolar level? That is given by the alveolar gas equation. Please remember, ठीक है, alveolar gas equation से भी काफी questions पूछे जाते हैं. So from the trachea, ठीक है, from the trachea, when oxygen is coming down to the respiratory tree, ठीक है, we are saying that the oxygen tension is further diluted. ठीक है, the oxygen tension which was around 149, ठीक है, it is coming down to 100. ठीक है, it is coming down to 100. Now why is it coming down to 100? 149 से 100 पे क्यों आ रहा है? That is because in the alveoli, ठीक है, in the alveoli oxygen is diluted, ठीक है, diluted with carbon dioxide. ठीक है, oxygen is diluted with carbon dioxide, and at the level of the alveoli it is denoted by the alveolar gas equation. Guys, this is a very important point. Please remember this. This is the alveolar gas equation, and this PaO2 at the alveolar level, it is given by Pi. Pi is the partial pressure of oxygen which is inspired. ठीक है, तो इंस्पायर में कितना था अपना 149, ठीक है, माइनस पार्शियल प्रेशर ऑफ कार्बन डाइऑक्साइड एट द alveolar level, that is 40 upon the respiratory question, upon the respiratory question. So the at the alveolar level, the partial pressure is how much we are inspiring, the partial pressure of oxygen which we are inspiring, that is Pi. तो कितना है? That is 149 minus the partial pressure of carbon dioxide at the alveolar level, that is 40 upon the respiratory question. So that gives us around 100 millimeters of mercury. So at the level of the alveoli, the partial pressure of oxygen is only 100 millimeters of mercury. Guys, are you getting my point? Is it clear? Is it clear? Any doubts still here? Dr. Porras, is it clear? Okay, so from the atmosphere to the trachea, because of the moisture, then alveoli में further decrease क्यों हो रहा है? Because of the dilution from the carbon dioxide. Now alveoli से कहाँ जाएगा ऑक्सीजन? ठीक है, because of the difference in the concentration gradient. Alveoli में oxygen का concentration is more in the inspired air. So because it is more in the inspired air, it will be flowing towards what? It will go towards the blood. ठीक है, so transport of oxygen from the alveolus to the blood, it is because of the concentration gradient. That is because of the concentration gradient. And because of this concentration gradient, the oxygen, it diffuses from the alveoli till to the pulmonary capillaries, to the pulmonary capillary. But alveoli में कितना था oxygen का concentration? Guys, how much was the oxygen concentration at the alveolar level? That was 100 millimeters of mercury. But we see that at the pulmonary capillaries, at the venous level, it is 95 millimeters of mercury. ठीक है, at the venous level, at the pulmonary venous level, it is 95 millimeters of mercury. Now why is it so? That is because of a phenomena. ये भी क्वेश्चन पूछा जाता है, ठीक है, that is because of the phenomena which is known as physiological shunting. ठीक है, physiological shunting. Now what do we know mean by shunt? What do we mean by shunt? ठीक है, शंटिंग का मतलब क्या हुआ? शंटिंग का मतलब क्या हुआ? That there is no exchange of gases. ठीक है, there is no exchange of gases. So basically there is no exchange of gases which is taking place. ठीक है. The gas is not being oxygenated, so in shunting there is no exchange of gases. It is just being ventilated, but there is no perfusion, so that will give us the shunting. So this occurs because of the shunting of the blood, that is the physiological shunt, and therefore there is further decrease in the oxygen tension from the alveoli to the pulmonary venous blood. Is it clear? Is it clear? So this is known, and this is because of the physiological shunting. That is, some amount of blood, it comes from the bronchial vessels, okay, which is not oxygenated, okay, which is not oxygenated, and that will, that will be added with that of the oxygenated blood, and therefore the oxygen tension is further decreased because of the physiological shunting. Is it clear? ठीक है. तो अभी तक हमने क्या पढ़ा? एटमॉस्फेयर से ट्रेकियल ट्री से alveoli, alveoli से it will go into the pulmonary circulation. Now alveoli से pulmonary circulation में क्यों जा रहे हैं? Because of the concentration gradient. ठीक है, because of the concentration gradient, and there is diffusion of gases. ठीक है, diffusion of gases. So diffusion, what does it mean? It is the movement of molecules from high concentration to low concentration. ये हम लोगों ने पढ़ा. Now the diffusion of the oxygen and the carbon dioxide, okay, the diffusion of oxygen and carbon dioxide, it occurs through what is known as respiratory membrane. ठीक है, it occurs through what is known as respiratory membrane. और इसमें क्वेश्चन क्या आता है? इसमें क्वेश्चन आता है, what are the components, okay, of respiratory membrane? Or respiratory membrane is formed by all of the following except. तो respiratory membrane किस किस के बीच में बन रही है? एक तो alveoli के बीच में, ठीक है, और एक ब्लड कैपिलरी के बीच में. ठीक है. Dr. Thabe, welcome to the class. I hope till this point of the lecture it is clear. Okay, if any doubts, please let me know. Others also, please let me know if you have any doubts. Okay, so now I was telling there is the diffusion of gases which is occurring from the alveoli till the blood, and that diffusion of gases is occurring through the respiratory membrane. The respiratory membrane किस किस में फॉर्म हो रही है? किस किस के बीच में फॉर्म हो रही है? In between the alveoli and the blood vessels, right? So what are the layers? Okay, so starting from the alveoli में the first layer is the surfactant layer. ठीक है, the surfactant layer which prevents the alveoli to get collapsed. ठीक है, so first is the surfactant layer, then will come the alveolar epithelium, okay, and then comes the basement membrane. ठीक है, so alveolar side में क्या क्या है? पहला तो surfactant layer है, फिर तो surfactant layer है, ये जो पर्पल कलर का है ये surfactant layer है, फिर इसके बीच में ये alveolar epithelium, और फिर लास्ट में थर्ड लेयर इज द बेसमेंट मेम्ब्रेन. ठीक है, फिर बीच में क्या स्पेस आएगी? ये जो स्पेस है, दिस इज द इंटरस्टिशियल स्पेस. ठीक है, इन बिटवीन द alveolar epithelium and the basement membrane of the between the alveolar and the capillary. ठीक है, तो कैपिलरी में सबसे पहले क्या आएगी? कैपिलरी बेसमेंट मेम्ब्रेन. ठीक है, फिर कैपिलरी में एंडोथीलियम, एंड देन, ठीक है, so these are the 6 layers. ठीक है, तो respiratory membrane is formed, remember, by the 6 layers. And what are these layers? From the alveoli till the capillary, the first is, okay, the first is the surfactant layer, then surfactant, ठीक है, then alveolar epithelium, then the basement membrane of alveoli, then interstitial membrane. ठीक है ना. फिर कैपिलरी में क्या आ रहा है? कैपिलरी में हमारा आ रहा है कैपिलरी बेसमेंट मेम्ब्रेन, एंड देन कैपिलरी endothelium. So these are the 6 layers which form the respiratory membrane through which the diffusion of gases takes place. because the concentration of the oxygen is higher in the alveoli in the inspiratory gases, so it will diffuse from the alveoli till the capillaries. Is it clear? Any doubts at this point? Okay. Now, ये जो diffusion of gas है, ठीक है, another important point, ठीक है, diffusion of gas from the alveoli till the capillary, it is based upon the Fick's law. It is based upon the Fick's law. So what is the Fick's law of diffusion? The Fick's law of diffusion states that the diffusion of the gas, it is directly proportional to the surface area and inversely proportional to the thickness of the membrane. Okay? Thickness of the membrane, the respiratory membrane. So more the surface area, okay, more the surface area, okay, the more will be the exchange of the diffusion of the gases, and more the thickness of the respiratory membrane, okay, less will be the diffusion of the gases. Okay, so this is very important. Please remember, according to the Fick's law of diffusion, the diffusion of the gas is directly proportional to, okay, the surface area, and it is indirectly proportional. The diffusion of the gas is directly proportional to the surface area, and it is inversely proportional to the thickness of the membrane. So the next important point which comes is the diffusion capacity. Okay, the diffusion capacity of the lung, it is measured with carbon monoxide. So which gas is used to monitor the diffusion capacity of the lung? That is carbon monoxide. Is it clear? Is it clear? So the diffusion capacity is of the lung is measured by the carbon monoxide. Okay, so what are the factors? इस पे भी क्वेश्चन आए हुए हैं. The factors which decrease, ठीक है, decrease the diffusion capacity. ठीक है, तो अपन ने क्या पढ़ा था? Diffusion, it is directly proportional to the surface area, inversely proportional to the thickness. So any disease, ठीक है, which increases the thickness of the membrane, diffusion will decrease. ठीक है, तो increase in the thickness of the membrane as seen in pulmonary fibrosis, as seen in sarcoidosis, there is decrease in the diffusion of gases. Okay, there is decrease in the diffusion of oxygen from the alveoli to the pulmonary capillaries. Okay, now emphysema, VQ mismatch, इसमें क्या हो रहा है? There is decrease in the membrane surface area. Emphysema में क्या हो रहा है? There is loss of elasticity. ठीक है, there is collapse. तो क्या होगा? There is decrease in the surface area. So therefore, the exchange of the gases does not take place easily. So there is decrease in the diffusion capacity in the emphysema and the VQ mismatch. If there is decrease in the uptake by the RBCs, ठीक है, ऑक्सीजन क्रॉस तो हो गई, मगर वो कैपिलरी आरबीसीज उसका अपटेक नहीं दे रही है. देयर इज डिक्रीज इन द अपटेक बाय द आरबीसीज, दैट इज इन अनीमिया. ठीक है, अदर कॉजेस लाइक पल्मोनरी एडिमा, pulmonary embolism, that also because there is difference in the membrane, the respiratory membrane, there is fluid. Pulmonary edema में क्या होगा? Fluid in the lung parenchyma. तो क्या होगा? Diffusion of the gases, there is decrease in the diffusion capacity. ठीक है? Now there are certain drugs. Remember, okay? Dr. Zubair, is there any doubt? You have typed pulmonary edema. Is there any doubt? Others, are you getting my point? If at any point you are not understanding, please let me know. Okay, abhi I am discussing about the diffusion capacity. Diffusion capacity of the lung. First question पूछते हैं, what gas is used to measure the diffusion capacity? It is carbon monoxide. ठीक है. Second, diffusion capacity, it is according to the Fick's law of diffusion. ठीक है, Fick's law of diffusion. Second question. Third question, the Fick's law of diffusion, it is directly proportional to the surface area and inversely proportional to the thickness of the membrane. So I told that the thickness of the membrane, more the thickness of the membrane, less will be the diffusion. So therefore, in case of pulmonary fibrosis, sarcoidosis, there is decrease in the diffusion capacity because of the decrease in the surface area, like in emphysema. Okay, there is decrease. Now, decrease by the uptake of the RBCs, anemia, that will also cause decrease in the diffusion capacity. Now, there are certain drugs. Please remember, taking a pharma के point of view से भी very important है. Drugs which cause decrease in the diffusion capacity is bleomycin, amiodarone, and methotrexate. ठीक है, bleomycin, amiodarone, and methotrexate. In fact, I have seen a case in which because of bleomycin there was pulmonary fibrosis and that caused decrease in the diffusion capacity. Okay, now there are certain factors which increase. Remember polycythemia. Please remember, in polycythemia, in alveolar hemorrhage, there is increase in the diffusion capacity. ठीक है, हाई ऑल्टीट्यूड के केसेस में भी आरबीसीज इंक्रीज हो जाते हैं, है ना, आरबीसीज इंक्रीज हो जाते हैं एंड देयरफॉर देयर इज इंक्रीज इन द डिफ्यूजन कैपेसिटी. And also in smoking, when it is measured within 24 hours, there is increase in the diffusion capacity because there is increase in the carbon monoxide level in smoking, and therefore there is increase in the diffusion capacity which is seen. Okay, okay, so these are the factors which increase the diffusion capacity. Dr. Uday, Dr. Zubair, Dr. Thabe, Dr. Porus, is it clear? Is it clear? Any doubts in this? ये बहुत important points हैं, ठीक है, ऑक्सीजन ट्रांसपोर्ट में. ठीक है, सबसे पहला अभी तक हम लोगों ने क्या क्या पढ़ा इस लेक्चर में? ऑक्सीजन ट्रांसपोर्ट. ठीक है, सबसे पहले हम लोगों ने पढ़ा डाल्टन्स लॉ. ठीक है, डाल्टन्स लॉ ऑफ पार्शियल प्रेशर. Then we are studying about the oxygen cascade. Remember guys, this oxygen cascade is a very important point. Oxygen cascade में हमने पढ़ा कि how the oxygen tension is decreasing from the atmospheric level till the mitochondrial level. ठीक है, क्वेश्चन पूछते हैं alveolar gas equation. ठीक है, so please remember what is alveolar gas equation. Please remember this formula also. At the alveolar level, the partial pressure of oxygen is equal to the partial pressure of oxygen in the inspired air minus partial pressure of carbon dioxide at the alveolar level upon the respiratory coefficient. And at the alveolar level, CO2 is equal to 40 millimeters of mercury. Please remember this. ठीक है, ये सारे क्वेश्चंस पूछे जाते हैं. फिर उसके बाद दूसरा क्वेश्चन, from the alveolus it is going into the blood, and that is because of the concentration gradient. और इसमें फिक्स लॉ ऑफ डिफ्यूजन आता है. फिक्स लॉ ऑफ डिफ्यूजन के हिसाब से the diffusion, it is directly proportional to the surface area and inversely proportional to the thickness. And the diffusion capacity, another important, the diffusion capacity of the lung, the gas which is used to measure is carbon monoxide. It is the carbon monoxide. So till now, these are the important questions, the MCQ questions which are asked in the exams. Okay, then what are the factors which increase or decrease the diffusion capacity? Is it clear? Is it clear? Can I move ahead? Can I go to the other slide? Okay. Now, अब alveolus से blood पे आ गया. ठीक है, alveolus से blood पे आ गया. So, how is oxygen? ठीक है, how is oxygen carried in blood? Carried in blood. Okay, so the oxygen is carried in blood in two forms. Oxygen is carried in blood Dr. Zubair is asking me to explain the Dalton's law and the oxygen cascade. Yes, Dr. Zubair, I'll just revise it with you. Okay, the Dalton's law of partial pressure, guys, just give me 1 second. I'll just revise quickly. The Dalton's law of partial pressure states that, see, अपना atmospheric pressure कितना है? That is 760 millimeters of mercury. So this pressure, this total atmospheric pressure is exerted. It is equal to the sum of partial pressure of individual component in a gas mixture. अपना air किससे बनी है? Oxygen plus nitrogen plus carbon dioxide से, है ना? So the total pressure, it is equal to the partial pressure which is exerted by oxygen plus partial pressure exerted by nitrogen and partial pressure which is exerted by carbon dioxide. तो जो भी गैस का मिक्सचर है उसका टोटल प्रेशर इज इक्वल टू कितना परसेंटेज ऑफ ऑक्सीजन प्रेजेंट है, कितना परसेंटेज ऑफ नाइट्रोजन और कितना परसेंटेज ऑफ कार्बन डाइऑक्साइड. तो अब ऑक्सीजन का पार्शियल प्रेशर कितना हुआ? एयर में कितना होता है? 21%. ठीक है, तो द पार्शियल प्रेशर ऑफ ऑक्सीजन is equal to 21% of 760, that is around 160 millimeters of mercury. Are you getting my point, Dr. Zubair? Are you getting my point? So this is the Dalton's law of partial pressure. जो टोटल प्रेशर है एक किसी का भी गैस मिक्सचर है, ठीक है, एक हम लोगों ने गैस लिया, ठीक है, ये टोटल प्रेशर अगर इसका 500 है, ठीक है, सो दैट इज बिकॉज ऑफ द प्रेशर विच इज एक्सर्टेड बाय डिफरेंट गैसेस. ठीक है, फॉर एग्जाम्पल अगर इसके अंदर ऑक्सीजन है, ठीक है, और कार्बन डाइऑक्साइड है, ठीक है, हीलियम है, तो कितना परसेंटेज ऑफ हीलियम है, कितना कार्बन डाइऑक्साइड है, कितना, तो उसका सम विल बी द टोटल प्रेशर. दैट इज डाल्टन्स प्रेशर. नाउ ऑक्सीजन कैस्केड, अभी हमने देखा इंस्पायर्ड एयर में कितना ऑक्सीजन है, ठीक है, इंस्पायर्ड एयर में इट इज 158 बिकॉज 21% ऑफ 760. मगर हम देखते हैं कि जब तक ऑक्सीजन इंस्पायर्ड एयर से, ठीक है, एल्वियोलस तक आता है, एल्वियोलस से ब्लड में आता है, टिश्यू लेवल तक आता है, इट इज ओनली 40 millimeters of mercury. So why is there decrease in the oxygen tension from 158 to 40? That is because of the oxygen cascade. That is because of the oxygen cascade. So basically, what is oxygen cascade? That is process of decreasing oxygen tension from atmosphere to the mitochondria. That is oxygen cascade. Now, why is it happening? ठीक है, ड्राई एटमॉस्फेयर में कितना था? 158, अराउंड 160. ठीक है, जब ये एटमॉस्फेयर से ट्रेकिया में आता है तो क्या होता है? एटमॉस्फेयर में क्या था? 158 था. ठीक है, ट्रेकिया में कैसी एयर होती है? ट्रेकिया में देयर इज ह्यूमिडिफाइड एयर. ठीक है, तो इसमें ये ड्राई एयर में और क्या जुड़ गया? वाटर वेपर प्रेशर. ठीक है, वाटर वेपर प्रेशर, तो 760 माइनस वाटर वेपर का प्रेशर होता है अराउंड 47 millimeters of mercury, तो दैट इज अराउंड 713. ठीक है, इसका 21%. सो एट ट्रेकिया इट इज 21% ऑफ 713. That is equal to around 149, and therefore there is decrease of the oxygen tension from 160 till 150. Is it clear? Now alveolar gas में, ठीक है, alveoli के लेवल पे हम देखते हैं कि ऑक्सीजन का टेंशन इज ओनली 105. ठीक है, now from 149 it is coming down to 105 millimeters of mercury. Why is it so? That is because alveoli के अंदर the oxygen is diluted, okay, diluted with carbon dioxide. Are you getting my point, Dr. Zubair? Are you getting my point? Any doubts in this? ठीक है, so from 149 it is coming down to 105 in the alveoli because it is diluted with carbon dioxide, and that is known as alveolar gas equation. Okay, so the partial pressure of oxygen at the level of alveoli is equal to how much oxygen is in the inspired air minus it is diluted with carbon dioxide, right? So how much partial pressure of carbon dioxide is present at the alveoli upon the respiratory question. Upon the respiratory question. So inspired air में कितना था 150 माइनस alveolar लेवल पे कार्बन डाइऑक्साइड कितना है 40 अपॉन 0.8 it comes around 100 it comes around 105 now जब ये alveolar गैस से आर्टीरियल ब्लड पे जाता है तो इसका देखा है it is 100 now why there is drop of 5 this is because of physiological shunting ठीक है that is because of physiological shunting are you getting my point ठीक है physiological shunting में क्या होता है some amount of okay what is physiological shunting ठीक है some amount of deoxygenated blood ठीक है amount of deoxygenated blood from bronchial vessels ठीक है bronchial vessels या फिर pulmonary circulation it gets added to the pulmonary veins ठीक है which has oxygenated blood तो ये deoxygenated blood जब इस oxygenated blood के साथ add हो जाता है तो उसकी वजह से further decrease in the oxygen tension हो जाता है therefore at the level of the arterial blood it is only 100 millimeters of mercury capillary level tissue level पे because of the oxygen extraction okay extraction of oxygen by the tissues ठीक है it is further decreased to 45 and then yes Dr. Zubair the physiological shunting is because of the blood coming back from the bronchial veins and then capillaries may it is further decreased to 45 because of extraction of oxygen by the tissues okay and at the mitochondrial level that is only 5 millimeters of mercury which is the end point of oxygen cascade is it clear so this is what is oxygen cascade that is what I have explained you in the lecture is it clear Dr. Zubair Dr. Uday any doubts? Dr. Thabe, any doubts in this? This is a very important point. Questions are asked from the oxygen cascade. Okay? So that is what I have told you in the lecture कि वाटर वेपर प्रेशर 47 है इसलिए डिक्रीज हो रहा है फिर वो वहां से एल्वेलस पे आएगा दिस इज द सेकंड क्लास एल्वेलर गैस इक्वेशन फर्दर डाइल्यूशन हो रहा है एल्वेलस से ब्लड पे जा रहा है उसमें क्या हो रहा है बिकॉज ऑफ द फिजियोलॉजिकल शंटिंग फर्दर डिक्रीज हो रहा है एंड देन आई वाज टेलिंग यू अबाउट द डिफ्यूजन ऑफ द गैसेस फ्रॉम द एल्वेलाई टू द blood capillaries ठीक है that is through the respiratory membrane उससे related questions fixed law of diffusion ठीक है so this is the point which I have told you now the last point is oxygen from the atmosphere it has come till the blood right it has come to the blood now how is oxygen carried in the blood okay so oxygen is carried in the blood in two forms Oxygen is carried in the blood in two forms. One is the dissolved form and one is bound to hemoglobin. Okay? So oxygen is carried in the dissolved. It is dissolved in the plasma. It is only 3% of the total oxygen. Majority of it is carried by binding it to the hemoglobin that is oxyhemoglobin that is 97%. That is 97% ठीक है so dissolved in the plasma it is only 3% ठीक है and this is according to the Henry's law तो आज के लेक्चर में अपन ने 3 लॉ पढ़े पहले डाल्टन्स लॉ fixed law of diffusion, and then Henry's law. Please remember all these law. Questions are directly asked from these laws also. Okay? So in accordance to the Henry's law, the gas concentration in solution is equal to how much solubility coefficient it is into the partial pressure. Okay, so what does Henry's law state? Henry's law states that the gas concentration in solution, ठीक है, तो solution in the blood कितना oxygen dissolved है, तो gas concentration in the solution is equal to कितना उसका solubility coefficient है into the partial pressure, into the partial pressure. So oxygen का solubility coefficient is, remember, 0.003 ml. ठीक है, 0.003 ml, but this is per millimeters of mercury per 100 ml of blood, and mind it is at 37 degrees Celsius. Is it clear? So the solubility coefficient of oxygen is equal to 0.003 ml per millimeters of mercury per 100 ml of blood at 37 degrees Celsius. So for the partial pressure of oxygen कितना है? Arterial blood में कितना है? 100. ठीक है, तो गैस कंसेंट्रेशन कितना हो गया? 0.003 इंटू पार्शियल प्रेशर कितना आर्टीरियल में? इट इज 100. सो कितना कंसेंट्रेशन हो गया? कितना ऑक्सीजन का कंसेंट्रेशन हो गया? दैट इज इक्वल टू 0.3 ml of oxygen is present in 100 ml of blood. Is it clear? Is it clear, Dr. Zubair, Dr. Uday? Is it clear? Any doubts in this? ठीक है, so how much is the dissolved form of oxygen? Dissolved form of oxygen according to the Henry's law, solubility coefficient कितना? That is 0.003 ml per 100 millimeters of mercury. और arterial level पे अभी हमने क्या पढ़ा था? Arterial level पे it is 100 millimeters of mercury. जब तक oxygen arteries तक आते कितना हो जाता है उसका oxygen tension? That is 100 millimeters of mercury, and therefore it is 0.3 ml of oxygen is present in 100 ml of blood. ठीक है, now second, bound to hemoglobin कितना है? 97%. 97%. now normal adult में hemoglobin A form, and fetus पे it is hemoglobin F, that is alpha. So hemoglobin A is alpha 2 beta 2 and hemoglobin F is alpha 2 gamma 2. ठीक है, so each molecule of hemoglobin can bind with 4 molecules of oxygen. ठीक है, एक molecule of hemoglobin is bound to 4 molecules of oxygen, right? Is it clear? Any doubts still here? ठीक है, तो एक molecule of hemoglobin is bound to 4 molecules जब, अब इसमें से क्या होता है, जब first molecule, ठीक है, जब एक molecule of oxygen binds to the hemoglobin, ठीक है, heme, the shape of the globin it is altered. ठीक है, तो क्या होता है, जब भी एक ऑक्सीजन आके हीम कंपोनेंट के साथ अटैच होता है तो उसका शेप ऑल्टर हो जाता है, और जो 3 और ऑक्सीजन है इट इज इजीली बाउंड टू द hemoglobin. ठीक है, it is easily bound to the hemoglobin. Therefore, the subsequent molecule of oxygen are bound with greater affinity to the hemoglobin, and this is one of the cause. Okay, it is one of the cause for sigmoid shape, S-shaped curve of oxygen dissociation. Well, is it clear? Are you getting my point? Any doubts? Any doubts? So oxygen, it is carried in the blood in 2 forms. One is dissolved in the plasma and one is bound to the hemoglobin. Dissolved in the plasma is only 3%, bound to hemoglobin is 97%. And this I told you, once one molecule of oxygen it binds to the heme component, there is change in the structure, and other three molecules they attach with greater affinity with the hemoglobin. They attach with greater affinity with the hemoglobin. So 1 gram of hemoglobin, remember this is also a question. So 1 gram of hemoglobin, it transports 1.34 ml of oxygen. Okay, it transports 1.34 ml of oxygen. So how much is bound to hemoglobin? That is 1.34 into how much is the hemoglobin. जैसे अगर 15 ग्राम of hemoglobin है, ठीक है, तो 1.34 into 15 into the saturation of oxygen, into saturation of oxygen. ठीक है, is it clear? Is it clear? Any doubts? Any doubts? The total oxygen carrying capacity of the arterial blood, if hemoglobin is 15 gram per deciliter, है ना, if hemoglobin is 15 gram per deciliter, so 1 deciliter of blood contains how much? 1.34 into 15, that is around 20.1 ml. That is 20.1 ml. मगर कितना saturated होता है? 97% of it is only saturated. So our arterial blood में it is 19.8 ml of oxygen per deciliter. Is it clear? So these are also the questions which are asked. समझ में आया? How arterial blood has 19.8 ml of oxygen per deciliter? ठीक है, तो ऑक्सीजन कैरिंग कैपेसिटी ऑफ आर्टीरियल ब्लड इज 19.8 ml of oxygen per deciliter. दिस इज ऑल्सो अ क्वेश्चन. तो इसमें से डिसॉल्व फॉर्म कितना हो गया? 3%, that is 0.29 is present in the dissolved form, and 97% is present in the saturated form, that is 19.5 ml is in the bound form to hemoglobin. Is it clear? Any doubts? Guys, please let me know if you are understanding. Dr. Zubair, Dr. Uday, Dr. Thabe, is it clear? Are you understanding? These are the important questions which are asked. ठीक है, तो ऑक्सीजन कैरिंग कैपेसिटी ऑफ द आर्टीरियल ब्लड में कितना है? 19.8. उसमें से डिसॉल्व फॉर्म कितना हो गया? 3%, दैट इज 0.29. और बाउंड फॉर्म कितना हो गया? 19.5 ml is the bound form. ठीक है, ठीक है. Now, ऑक्सीजन कंटेंट वीनस ब्लड में, वीनस ब्लड कितना हीमोग्लोबिन सैचुरेटेड होता है? 75%. ठीक है, तो ऑक्सीजन कंटेंट इज ओनली 15.2 ml per deciliter. सो आर्टीरियल ब्लड में कितना था? आर्टीरियल ब्लड में इट वाज 19.5 और इसमें कितना है? 15.2. दैट मीन्स around 4.6 ml of oxygen is extracted by the tissues. These are all the important questions which are asked. ठीक है, remember hemoglobin at the venous level, venous level it is 75% saturated, and that means at the tissue level 4.6 ml of oxygen is extracted. ठीक है, ठीक है. Now very important point, coming to the oxygen dissociation curve. ठीक है, ओडीसी पे काफी क्वेश्चंस आते हैं. ठीक है, what is ODC? What is oxygen dissociation curve? It is dissociating. So from what it is dissociating? It is dissociating from hemoglobin. ठीक है, so the binding and release of oxygen from hemoglobin is assessed by the oxygen dissociation curve. That is, it reveals how much the amount of hemoglobin saturation at different partial pressure of oxygen values. Okay, so how much of it is saturated, how much hemoglobin is saturated against the partial pressure of oxygen in the arterial blood. ठीक है, तो y एक्सिस पे क्या होता है? सैचुरेशन, और x एक्सिस पे पार्शियल प्रेशर ऑफ ऑक्सीजन. रिमेंबर, एक्स एक्सिस पे इट इज द पार्शियल प्रेशर ऑफ ऑक्सीजन, ठीक है, एंड वाई एक्सिस पे इट इज द saturation of oxygen. So please remember this, ठीक है. At x-axis it is the partial pressure of oxygen and y-axis पे it is the saturated, ठीक है, how much hemoglobin is saturated with oxygen, ठीक है. So that is oxygen dissociation curve. Now we see ये जो shape of curve है, ठीक है, it is S shaped curve. It is sigmoid in shape. Now why is it sigmoid in shape? I told you because once the one molecule of oxygen is bound to hemoglobin, there is increase in the affinity for other oxygen molecules to bind, and that is one of the reason of the S-shaped curve. Now ये जो S-shaped curve है, इसके advantages हैं, ठीक है. ये जो एस शेप ऑफ कर्व है, इट ऑफर्स टू एडवांटेजेस एंड दिस इज ऑल्सो वन ऑफ द क्वेश्चन आस्क्ड. नाउ यू विल सी द अपर पार्ट इट इज फ्लैट, ठीक है, और जैसे हम लोग लोअर जाते हैं दैट इज स्टीप पोजीशन, दैट इज स्टीप पोजीशन. सो सी 60% 60 saturation तक it is almost flat. There is not much decrease in the partial pressure of oxygen in the arterial blood, ठीक है, with 60 saturation. So which means a large drop in the partial pressure of oxygen, ठीक है, 60 partial pressure of oxygen तक there is not much drop in the saturation, there is not much drop in the bound form of oxygen with hemoglobin, ठीक है. So the flat part of curve means a large drop in PaO2 down to 60 millimeters of mercury. There is only minor change in the arterial oxygen saturation. Please remember this point. The S-shaped curve, okay, the S shape of curve, even if the partial pressure of oxygen has dropped to 60 millimeters of mercury from 95 millimeters of mercury, there is not much drop, okay, there is not much drop in the saturated oxygen, whereas in the steep form, जब ये हम लोग स्टीप फॉर्म देते हैं, इवन अ स्लाइट डिक्रीज 60 से अगर ये 40 भी आया, इवन अ स्लाइट डिक्रीज, देयर इज वेरी मच डिक्रीज इन द सैचुरेटेड फॉर्म ऑफ ऑक्सीजन, ठीक है, इन द arterial oxygen saturation. Is it clear? Any doubts in this? Any doubts in this? Guys, please let me know. ठीक है, so the oxygen, okay, so this is the oxygen dissociation curve which is sigmoid in shape. Sigmoid in shape के दो advantages हैं. First advantage is as it is the upper part is flat, even if there is decrease in the oxygen partial pressure of oxygen from till 60, there is not much decrease in the saturation, ठीक है. और दूसरा पॉइंट है द स्टीप पोर्शन इज द वन वेयर द अनलोडिंग ऑफ ऑक्सीजन, ठीक है, टू द टिश्यूज हैपन. It is dissociated from the hemoglobin and there the unloading happens, ठीक है. Now there are certain points in the curve which are the anchor points, the important points in the curve. Arterial point, that is the PO2, ठीक है, आर्टरी पे जब 100 मिलीमीटर्स ऑफ मर्क्यूरी पार्शियल प्रेशर ऑफ ऑक्सीजन है, हाउ मच इज द सैचुरेशन? इट इज अराउंड 97.5, ठीक है. वीनस लेवल पे कितना है? 40 मिलीमीटर्स ऑफ मर्क्यूरी, उस वक्त सैचुरेशन होता है 75%, ठीक है. रिमेंबर व्हाट इज P50? P50 इज ऑक्सीजन, ठीक है, the partial pressure of oxygen, the partial pressure of oxygen at which it is 50% bound to hemoglobin. ठीक है, तो at SO2 of 50%, the PO2 normally is 27 millimeters of mercury, and that is P50, and that is P50. So what is P50? The P50 question, it is the partial pressure of oxygen at which hemoglobin is 50% saturated, and it is a marker. Remember, hemoglobin affinity for oxygen. ठीक है, and it is used to compare the position in the curve. तो अभी तक हम लोगों ने क्या पढ़ा? ऑक्सीजन डिसोसिएशन कर्व. ऑक्सीजन डिसोसिएशन कर्व इज बिटवीन y axis पे क्या है? सैचुरेटेड फॉर्म ऑफ ऑक्सीजन, हाउ मच ऑक्सीजन इज बाउंड टू हीमोग्लोबिन, एंड x axis पे क्या है? पार्शियल प्रेशर ऑफ ऑक्सीजन. ठीक है, दूसरा पॉइंट क्या पढ़ा? ऑक्सीजन डिसोसिएशन कर्व एस शेप्ड कर्व्ड है. व्हाट आर द एडवांटेज ऑफ द एस शेप्ड कर्व, वो पढ़ा. व्हाट इज P50? दैट इज इंपॉर्टेंट. P50 क्यों होता है? दैट इज यूज्ड टू कंपेयर द पोजीशन ऑफ द कर्व. जैसे अगर द कर्व इज, ठीक है, if there is increase in the P50, ठीक है, that means there is decrease in the affinity of the oxygen to the hemoglobin. ठीक है, so the curve will shift towards the right. If the curve is shifting towards the right side, if it is shifting towards the right side, that means more oxygen, ठीक है, is liberated towards the tissue, less affinity of oxygen towards hemoglobin. ठीक है, less affinity of oxygen towards hemoglobin. That is when the ODC is shifted towards the right. So when is the ODC shifted towards the right? When there is increase in the temperature, increase in partial pressure of carbon dioxide 2,3 dpg, or increase in the H plus ion concentration, that is decrease pH. What will happen? Temperature, partial pressure of carbon dioxide increase हो रहा है, तो क्या चाहिए? टिश्यूज को मोर ऑक्सीजन चाहिए, है ना? तो extraction of oxygen will be more, so the ODC will be shifted towards the right. ठीक है, the factors which decrease the P50 value, that is shift towards the left, that is decrease temperature, decrease PCO2, decrease 2,3 dpg. Is it clear? So this is very important graph. This is very important. Okay, the factors which shift the curve towards the right, that is there is decrease in the affinity of oxygen with hemoglobin. More oxygen is extracted by the tissue. तो कब होगा? जब मेटाबॉलिज्म इंक्रीज होगा, टेम्परेचर इंक्रीज होगा, पार्शियल प्रेशर ऑफ कार्बन डाइऑक्साइड, ठीक है, 2,3 dpg, that is increase. Now what is 2,3 dpg? Very important point. ठीक है, it is produced in the RBCs, in the pathway of the glycolysis. Now ये जो 2,3 dpg है, ठीक है, what it does, it binds to deoxyhemoglobin. Okay, it binds to deoxyhemoglobin, and therefore it reduces the affinity for oxygen, and more of it is available to the tissues. Okay, so that is why it increase in the 2,3 dpg, there is shift of the curve towards the right. Now what you have to remember is जो fetal erythrocytes हैं, they have lower concentration of 2,3 dpg, and therefore क्या होगा? 2,3 dpg कम होगा, less of it will be bound to the deoxyhemoglobin, more affinity of oxygen towards the hemoglobin, less of it is supplied to the tissue. There will be left shift of the curve. There will be left shift of the curve. Is it clear? Guys, is it clear? Any doubts? Any doubts still here? Okay. As you are not asking the doubts, I think it is clear. Okay, fine. So, now what are the factors which increase 2,3 dpg? Okay, please remember the factors which increase 2,3 dpg is anemia, hypoxemia, cardiac failure, chronic acidosis, uremia, cirrhosis of the liver. Okay, these are the factors which increase 2,3 dpg. That means oxygen to the tissues, okay, will be more. will be more. ठीक है, less affinity of oxygen to the hemoglobin. Decrease in 2,3-DPG is seen in polycythemia, hyperoxia, chronic alkalosis, hypothyroidism. Remember, it is also seen in blood storage. It is also seen in blood storage. So, in blood storage, the ODC is shifted towards which side? It is shifted towards left because of the decrease in 2,3-DPG level. This is the question which is most frequently asked. Okay? Now, other factors which affect the ODC is exercise. एक्सरसाइज करते हुए क्या चाहिए? मसल्स को ऑक्सीजन चाहिए, तो ओडीसी कहाँ शिफ्ट होगा? ओडीसी कहाँ शिफ्ट होगा? इट विल बी शिफ्टेड टुवर्ड्स द राइट साइड. ठीक है, एफिनिटी ऑफ ऑक्सीजन टू हीमोग्लोबिन विल डिक्रीज. ठीक है, द ओडीसी विल शिफ्ट टुवर्ड्स द राइट साइड. ठीक है, अदर फैक्टर्स. ठीक है, so exercise can work because of the increase in the carbon dioxide, increase in the temperature, and also myoglobin, it has higher affinity for oxygen. The ODC will be shifted towards the right side. The congenital abnormalities like hemoglobinopathies, it depends upon what hemoglobinopathy is and how much affinity of abnormal hemoglobin is there for oxygen. In case of pyruvate kinase deficiency, there is increase in 2,3-DPG. An increase in 2,3-DPG, it will cause right shift. So the question it can be asked, in pyruvate kinase deficiency, there is shift of the ODC towards the right side. ठीक है, कार्बन मोनोऑक्साइड इट हैज. ठीक है, कार्बन मोनोऑक्साइड ये क्या करता है? इट बाइंड्स टू हीमोग्लोबिन. ठीक है, सो देर इज लेफ्ट शिफ्ट टू इन द ओडीसी. नाउ अनीमिया. ठीक है, अनीमिया में देर इज 2 कंपनसेटरी मैकेनिज्म्स सो दैट मोर अमाउंट ऑफ ऑक्सीजन. अनीमिया में क्या चाहिए? मोर ऑक्सीजन इज अवेलेबल टू द टिश्यूज. तो क्या होगा क्रॉनिक स्टेट में? ठीक है, एक तो कार्डियक आउटपुट और ऑक्सीजन डिलीवरी इंक्रीज होगी, और दूसरा क्या करता है? देयर इज इंक्रीज इन द 2,3-DPG. अगर इंक्रीज होगा तो क्या होगा? इट विल बी शिफ्टेड टुवर्ड्स द राइट. मोर ऑक्सीजन विल बी अवेलेबल टू द टिश्यूज. ठीक है, सो अनीमिया में टू कंपनसेट फॉर द ऑक्सीजन डिमांड. ठीक है, तो एक तो कार्डियक आउटपुट इंक्रीज होता है, ऑक्सीजन डिलीवरी इंक्रीज होती है, और देयर इज इंक्रीज इन 2,3-DPG. ठीक है, एक्यूट स्टेट्स में जैसे शॉक के केसेस में, शॉक में भी क्या हो रहा है? द बॉडी इज नॉट एबल टू मीट द मेटाबॉलिक डिमांड्स, है ना? द ऑक्सीजन डिमांड्स ऑफ द बॉडी इज नॉट मेट. ठीक है, तो शॉक में भी क्या होता है? देयर इज इंक्रीज इन द 2,3-DPG. नहीं, शॉक के केसेस में द बॉडी इज नॉट एबल टू मीट द ऑक्सीजन डिमांड. क्यों? बिकॉज 2,3 वी सॉ दैट 2,3-DPG was lower. ठीक है, so there was high affinity of oxygen to the hemoglobin. ठीक है, now shift to the left. Important question. Massive blood transfusions. Why? Because of decrease in 2,3-DPG in the stored blood. हाइपोथर्मिया, हाइपोफॉस्फेटेमिया. ठीक है, हाइपर वेंटिलेशन क्या होगा? इंक्रीज इन PCO2 लेवल, decrease in PCO2 level. That will cause the curve to shift to the left. Is it clear? Any doubts still here? Guys, the ODC curve is very important. That's why I'm discussing this in detail. Okay, so these are the factors which affect the ODC curve. Now, next very important point, what is Bohr effect? Remember, Bohr effect is seen because of the decrease in the pH of the blood. So there is a right shift of ODC. But why is it? Because of the decrease in the pH of the blood. It is not related to 2,3-DPG. Please remember this. Please remember this. The Bohr effect is seen because of the decrease in the pH of the blood. Okay? Because of the decrease in the pH of the blood, there is decrease in the oxygen affinity of hemoglobin, and therefore the release of oxygen to the tissues is increased, and the Bohr effect is the rightward shift of ODC because of decrease in the pH. Okay, because of decrease in the pH, and that is Bohr effect. That is Bohr effect. Now, what is double Bohr effect? Another very important question. The double Bohr effect is seen where? It is seen in the feto-maternal interface. What happens, guys, is, see, fetus में मेटाबॉलिज्म हो रहा है, फीटल साइड में मेटाबॉलिज्म हो रहा है, तो उसका जो कार्बन डाइऑक्साइड है एंड अदर मेटाबॉलिक प्रोडक्ट्स फ्रॉम द फीटल साइड, ठीक है, फ्रॉम द फीटल साइड द कार्बन डाइऑक्साइड एंड अदर मेटाबॉलिक प्रोडक्ट्स वो कहाँ आ रहा है? इट इज कमिंग टूवर्ड्स द मैटरनल साइड. ठीक है, इट इज कमिंग टू द मैटरनल साइड. तो मैटरनल साइड पे क्या हुआ? Maternal side पे there is increase in carbon dioxide and there is increase in the H plus ions. ठीक है, so maternal blood is more acidic. So ODC कहाँ shift होगा? It will be shifted towards the right. और fetal blood, इसमें क्या हो रहा है? इसमें क्या हो रहा है? कार्बन डाइऑक्साइड कम हो रहा है ना, मेटाबॉलिज्म, मेटाबॉलिक प्रोडक्ट्स कम हो रहे हैं, सो इट इज मोर अल्कलाइन. सो हियर द ओडीसी इज शिफ्टेड टुवर्ड्स द लेफ्ट. ठीक है, सो डबल बोर इफेक्ट इट इज सीन इन द फीटो मैटरनल. ठीक है, मैटरनल साइड पे बिकॉज ऑफ द डिफ्यूजन ऑफ कार्बन डाइऑक्साइड एंड द मेटाबॉलिक products from the fetal side to the maternal side, maternal blood is more acidic, so the ODC is shifted towards the right. Or fetal side में it is more alkaline, it is shifted towards the left. Is it clear? So this is the double Bohr effect. So in today's class, to sum up, okay, one second guys. To sum up, in today's class, what did we study? The first, the questions. The important questions or MCQ that can be asked is, एक तो Dalton's law of partial pressure, then second oxygen cascade. ठीक है, what is oxygen cascade? What is alveolar gas equation? ठीक है, MCQs are asked in this. ठीक है, then important point is Fick's law of diffusion. Okay, then DLCO, the factors which increase it or decrease the DLCO. ठीक है, then oxygen carried in blood in two forms, dissolved and bound to hemoglobin, and दूसरा है bound to hemoglobin. hemoglobin bound से फिर क्या होता है? ODC, ODC कर्व. ODC में यहाँ की तरफ क्या होता है? It is the oxygen which is saturated with hemoglobin, और यहाँ पे arterial, partial pressure of oxygen in the arterial blood. Then the factors which affect the ODC, ठीक है, very important point, and other Bohr effect. And remember, Bohr effect is because of it is because of the decrease in the pH, and it is not related to the 2,3-DPG. Is it clear? Remember the factors which increase or decrease 2,3-DPG. That is also very important point, so that you can solve maximum amount of MCQs from. So this was the theoretical point of view. I will discuss with you the MCQs which has been asked and how the questions can be asked from this topic in the coming sessions. Is it clear? Any doubts? Any doubts? Dr. Zubair, Dr. Uday, others, any doubts? Okay. So, thank you, friends. That was all for today's class. And as you know, on the YouTube, we have a channel. Okay. And let's crack Neet PG. Please subscribe to it. Click the bell icon. And also we have on the Telegram, we have a app. Sorry, on the Telegram app, we have a channel. Let's crack Neet PG. Okay. Let's crack Neet PG. On this channel, we are daily updating when will be the classes held and what will be the topics which will be covered. So please follow us on the Telegram channel also, and please use my referral code Apoorva. Okay, this is the referral code. Referral code Apoorva to get the plus and the iconic subscription. The advantages of these two I told you earlier in the class, and get 10% discount on the plus and iconic subscriptions. So friends, I hope that was clear. Any doubts, please let me know. And tomorrow at 7 p.m. on YouTube, we will have transport of carbon dioxide. We have a transport of carbon dioxide, which is yet very important topic. I hope today's class was clear. If any doubts, please let me know. Okay, friend. So thank you and have a